Welcome back. Still looking at the long-term impact of COVID-19 across the world. Joining us for more on this is Dr. Adora Enechukwu. She's a GP registrar, emergency medicine, Central London. Thanks, Dr. Enechukwu, for joining us on the program.
Thank you for having me.
Let's begin with what's happening where you are. Is London still the epicenter of the pandemic in England?
I think as one of the most densely populated cities, or if not the most densely populated city in the country, we are still seeing the vast majority of cases in London, but there are pockets in other sort of major cities, Birmingham, Manchester and things like that. But it is still more in London, although we're seeing a massive reduction in terms of cases and the amount of deaths as well.
Over the weekend, we heard about protests arguing against the need for restrictive COVID-19 measures imposed by governments, claiming that they evoke panic, infringe on people's rights rather than the public health measure that they're meant to curb. And this is across Germany and some parts of Europe. What's your take as a health worker?
I mean, I think you have to look at it from both angles. At this point, especially if people have been following lockdown guidelines, a lot of people have been self-isolating for, about 9 weeks now. So I think what we're seeing a lot of is people's frustration. We've discussed mental health, at various different times. And I think a lot of people are feeling anxiety and stress. And I think it is easy to feel as though your freedom is being taken away in a sense, especially if you look at all of those factors. I think the most important thing, though, that we have to reiterate is the importance of following government guidelines and staying isolated until we are told that it's safe. Regardless of how we feel, ultimately the most important thing is to put other people around you first, as well as yourself. So I think it's definitely understandable. I think we're all going through an immense amount of stress and strain. But the most important thing, I think, is to follow guidelines until it's safe and just to prevent that second peak, because that will be much worse for everyone.
If I might quickly ask about your thoughts about some of the allegations on Dominic Cummings and being asked to resign.
Yes, I think it's a bit of a tricky one. From my understanding of the case, he and his wife, were unwell, and that was part of the reason why they were driving up. And I think also from the public standpoint, a lot of people are very, very frustrated. And when you look at the reasons why, it's because people have been following guidelines. There are lots of people who aren't, but there's a vast majority that I think are actually following guidelines. But because of that, they've not been able to see loved ones. People have passed away and been buried, and they've not been able to see their family or say last goodbyes or do things like that because they were following guidelines. So I think there is a lot of public outroar, as it were, because people feel very strongly that they have been following the rules and that the government who have put these rules in place do not appear to be following it. I don't think we have all of the facts with regards to why he went or how many times he went, and it's not really for me to speculate. But I think looking at all of those factors, coupled with the fact that people have been locked up for over 2 months, I think the public is very outraged, and I can understand why.
Now, Adora, talking about guidelines, Japan has come up with a model saying the world should emulate that has been able to reduce from 600, 700 a day of cases from mid-April to about 20, 30 cases last week. And the local explanations are that Japan's success was with the culture of wearing the face mask, obedience to government requests, and the effectiveness of the country's contact tracing system. What do you make of that?
Japan has done really well, and I'm hopeful that the UK can sort of follow in their footsteps, and Nigeria as well. I think initially there was some hesitation with regards to advising people on face masks, and I think some of that did have to do with actual lack of equipment. But as of in the last couple of months, especially in public areas, so we're seeing in the tube stations, trains, buses, people are being advised to wear masks. So we are sort of heading in that direction. And I think it makes sense. If you're in a crowded area, a public area, it protects others from anything that you might have, and it also protects you. And I do think it's important, and we seem to be heading that way, which is really reassuring.
Let's quickly get your thoughts. We hear that the Lancet has a new study that says the urgent need to evaluate real-world evidence related to the outcomes of using hydroxychloroquine, that the drug rather increases the chances of dying in COVID-19 patients. Is that any different from the care that the WHO has sounded with the use of hydroxychloroquine to treating COVID-19?
I don't think, as of yet, we've been given any firm answers with regards to either encouraging us to use it or saying that it can have a completely negative impact. The difficulty is obviously there's been a paper, but usually with these sorts of things, we want, multiple papers, and then we want to peer review them. It's all about the quality of the evidence. And I think that at this point, there isn't enough evidence to say that it should be recommended. What we do know is that hydroxychloroquine, like a lot of other drugs, have lots of side effects that can be really detrimental to a lot of people's health. So that's one of the reasons why from the very beginning we were sort of strongly urging people not to take medication unless prescribed by their doctor.
All right, we'd like to thank you, Dr. Adora Enechukwu, GP Registrar, Emergency Medicine, Central London. Thanks for joining us.
Thank you for having me.